Hi, my name is Medeiros, and today I'm going to be talking about the blood supply to the brain and the spinal cord. I'm going to be talking about two different systems. First one's going to be the internal carotid system, and the second one's going to be the vertebral basilar system. So let's get into it. Located here and here, you have your two internal carotid arteries. These come from the common carotid arteries, which then bifurcate to form the internal and external carotid arteries. From there, the internal carotid arteries then bifurcate to form the middle cerebral arteries located here and here. And the anterior cerebral artery is located here and here. Together, these are responsible for supplying the cerebrum, but more specifically, the anterior cerebral arteries are responsible for supplying the medial aspects of the cerebrum, such as the frontal and parietal lobes, and then the middle cerebral arteries are responsible for supplying the lateral aspects of the cerebrum and much of the pre- and post-central gyri. If you look specifically at the middle cerebral arteries, you can see these tiny branches coming out, and these are known as the lenticular striae arteries. They're responsible for supplying deep structures within the telencephalon and diencephalon. Now looking at the vertebral basilar system located here and here are your two vertebral arteries. They arise from the subclavian artery or arteries, and then at the junction of pons and medulla, the two vertebral arteries fuse here, and then they form the basilar artery, which is located here. And then at the lower level of the midbrain, the basilar artery then bifurcates to form the two posterior cerebral arteries located here and here, which I'll talk about more specifically later. Now getting into the specific branches of the vertebral basilar system located here. And here we have the posterior inferior cerebellar arteries. They're responsible for supplying blood to the inferior surfaces of the cerebellum, as well as the lateral medulla. Above that, you have your anterior inferior cerebellar arteries located here and here, and they're responsible for supplying blood to the anterior portions of the inferior surfaces of the cerebellum, as well as the caudal pons. Above that, you have your internal auditory arteries, which are located here and here, and they're responsible for supplying blood to the inner ear. Above that, you have your group of arteries over here, known as the pontine arteries, which are responsible for supplying blood to the pons. Above that, you have your superior cerebellar arteries located here and here. And they're responsible for supplying blood to the superior surfaces of the cerebellum, the caudal midbrain, and then the rostral pons. Above that, you have your two posterior cerebral arteries located here and here. They're responsible for supplying blood to the splenium of the corpus callosum, the posterior portions of the diencephalon, the rostral midbrain, and then the inferior and medial portions of the occipital and temporal lobes. Now looking up over here, going back to the other system I was talking about with a mixture of a couple other things. Here and here, like I mentioned before, you have the anterior cerebral arteries, as well as the two posterior cerebral arteries, and then your internal carotid arteries. Now, something else that we have going on here is the one anterior communicating artery, as well as the two posterior communicating arteries. Now, together, these arteries form the circle of Willis, which is the articulatory circular structure right here. The circle of Willis is important because it's responsible for ensuring that there's a constant supply of blood flow to the brain. Thank you.